Before we start, Representative Petrie, if you'll lead us in a moment of prayer, please.
Yep. Let us pray. Dear Heavenly Father, we thank you for this day and this opportunity to be together. We pray that you would grant us wisdom, and we ask all of this in the name of our beloved Savior, Jesus Christ. Amen.
Amen. Okay, today we have House Resolution 618 by Representative Clark. Representative Clark, you want to step down there to the podium and tell us about your bill, please.
Mr. Chairman and ladies and gentlemen, we're an aging state, and an aging state has different needs. We're now sponsoring numerous services for our aging public, including transportation, in-home care. Several are on supplemental security income. They receive Georgia Power discounts, Medicare counseling, dementia services, long-term care, ombudsman program, and it's all coordinated through the Aging and Disability Resource Program, but few save the state more money than adult day services. Adult day services are serving people following hospital and nursing home episodes. It has rehab. It cares for persons with significant chronic needs, hypertension, physical disability, cardiovascular disease, diabetes, mental illness, and developmental disability. Also, nearly half of the participants nationally have been diagnosed with Alzheimer's or some other dementia. So, ladies and gentlemen, this is a need. We need to study it. It is a money-saving idea for our state, and it's something of great concern to all of us. And these are these adult day services. Mr. Tom Bauer represents adult day services, and we also have Mr. Ned Morgans, the former president of this group. So, Mr. Bauer.
Mr. Chairman, members of the committee, I'll be real brief. I'm Tom Bauer with Leading Age Georgia, and we represent a whole continuum of care providers, mostly nonprofits, and the Georgia Adult Day Services Association is part of under our umbrella. You might recall from the budget last year that there was a push. There had been a co-age priority, about 15 years ago, to license adult day centers, and we finally got it funded last year, so the Department of Community Health is now in the process of starting to license folks, and we're talking about people going to accredited services with dementia, with health. There are two kinds of adult day centers. There's what's called the social center, and then there's the a health center, and they are distinguished in the rules. Mr. Morgan's, actually all of yours are health centers, is that right? And they are both for-profit and non-profit. What we're seeing is an intersection of several issues that we think need looking at, and one of them is that the Medicaid non-emergency transportation starting a couple of years ago, and I do want to say that we've had some pretty intense discussions with DCH, and we've made some good progress, but there were some mileage limits put on where for 15 miles within the urban area or 30 miles within a rural area, where the brokers, the managed care brokers for transportation, had the leeway to send an adult to that center, the closest center. But that policy is in conflict with the Community Care Services Program and the other waiver programs. And quite frequently, you have a senior who needs to go to a specific place where their dementia services or something like that. And the reimbursement policies are really kind of all over the map, and even to the point that that under Medicaid, if adult day wanted to provide their own transportation, it would be more cost effective. It's really not allowable under the program. So that's one of the things that's in your whereas on the study committee that we would like for it to be looked at. Another is just the fact that some of the referrals are down, and we think sometimes that's because family members don't want to mess with the transportation and the bureaucracy. So, as Representative Clark said, we think this is an issue that really needs addressing. The way it was drawn up, I don't think it should be any cost beyond the legislator per diem. I'd be happy to answer any questions, and Mr. Morgans is here. He's sort of an expert on adult day if you need more information.
Anyone have any questions for Mr. Bauer? Don't see any.
Thank you, Mr.
All right,
Chairman.
Mr. Morgan?
Hi, my name is Ned Morgans. I'm a former chairperson for the National Adult Day Service Association and going to be the incoming or existing president for the Georgia Adult Day Service Association right now. I do apologize for looking a little grubby today. The plan was to be working on fixing some stuff up at one of the centers, and then I got the call around 12 and from Johns Creek to come down here. So apparently it's just about an hour and a half from Johns Creek to the Capitol. When you're driving really fast. Just kind of one thought, and then I'd love to answer any questions that you might have about adult day services. In general, I think our providers for adult day services are really excited to be doing this work, to serve this older Georgians who have health-related needs. Some of them are fairly intensive. As well as all of us end up serving younger adults between the ages of really 21 and 65, whether they've early onset Alzheimer's, have had a stroke, brain injuries, or other forms of disabilities. One of the reasons why I'm hoping that you all will look favorably towards the study committee is I think that adult day services in Georgia is really under a lot of pressure. And it comes from a number of different places. One of the areas that Tom Bauer alluded to is through transportation. And every 5 years there's a new contract that came out, and when the last contract was initiated, it really put a lot of pressure on adult day services and the ability to transport clients from their homes to our centers and back, and a lot of people actually lost services because of that rule change. Another issue that's going to come up comes from the Home and Community-Based Services rule that the CMS initiated, and that's going to have some issues, some pressures in terms of where adult day services are allowed to take place, whether that's in a senior center. So you have some county-run programs that might be affected, or that are in hospitals, and so and there are several of those around the state in smaller communities, which are both kind of prohibited per se, and so that the effect of that's happening. The other part of it, and I'm not really sure why this is happening, but last year I got some information from Janet Rohrbach from the Division of Aging Services asking about utilization in the Community Care Services Program for adult day health. And we looked at the numbers from 2009 to 2013. Overall in the state, the utilization was down about 10%. In the Atlanta region, that was down about 20%. And the result, and then the other program that many of us are involved with is the SOURCE program. And the SOURCE program has undergone a lot of reorganization and level of care programs. So all of our providers have, and I don't have the exact numbers on the SOURCE program, but our providers are finding a lot of drop in utilization from the SOURCE waiver program as well. The result of these changes is that what we're finding is that there are a number of centers who've gone out of business in the last couple of years. So we're probably looking at, probably 4 or 5 in the last 3 or 4 years across the state that I'm aware of. We've had, there's a center up in Gainesville who's nonprofit who's dropped out of the CCSP program and all the Medicaid waiver programs. just because they can no longer afford the compliance and the cost issues as well as the referral issues, and they are in a position where they can raise the money to be able to serve the individuals that they had beforehand, as well as meet their mission. One of our largest programs, which is operated by the Atlanta Jewish Community Center, which is the Weinstein Center, had been it's probably one of the first programs in Georgia, closed its doors last July. I can't say precisely why that happened, but I do know that one of the reasons that the center was certainly struggling with some of the referral issues of what's happening in terms of utilization. And so what I would hope to see happen with the study committee is just get an understanding of what is what is going on in Georgia, why are things happening, why is utilization down so much, and having such a dire effect on the provider community for adult day services. And also maybe we can get a sense of what other states are doing, and try to come up with some reasons for why it's happening, as well as some ways to improve the provider networks, so we can be actually serving Georgians in a much better fashion than what we're currently able to do at this time. So, if there are any questions or.
Does anyone have any questions for Mr. Morgan? All right, number 2.
So, Mr. Chairman, thank you. These are just out of my curiosity questions, because I'm not very familiar with this, what all's going on. How many of these CCSPs are out there? It might be Mr. Bauer, it might be you. How many programs are there across the
think
state?
in the Atlanta area, you're probably looking at about 30, and that's in the 10-county Atlanta Regional Commission area. Across the state, in terms of programs that are in the CCSP and SOURCE program, I would estimate that somewhere close to about 90 total, maybe up to 120. I think there's 150 programs altogether in the state that would include non-Medicaid waiver programs as well as Medicaid waiver programs.
Mr. Chairman, can I continue? Go ahead, Mr. Bauer.
I was just going to say, I'd mentioned they're in the processes of licensing them now, so we'll have a better idea of the number. But just to be a little clearer, CCSP, of course, offers a range of services, and adult day would be a place you would refer, would be one of those services that CCSP refers to too.
How many of those are for-profit versus non-profit? Are most of them for-profit or most of them non-profit? What's the...
I do not know what the breakdown is in Georgia. My sense is you probably have a few more for-profit centers in Georgia than you do nonprofits. Nationally, it's generally 75% are nonprofits, about 25% are for-profits. But most of the colleagues that I'm coming into contact with have probably said they seem like they're operating on a for-profit level, although for some of them that may be just a tax identity, not reflective in their bottom line and their P&L.
Also, what is SOURCE? I mean, it's not spelled out here, but I'm just curious. What is SOURCE?
So in the Medicaid waiver programs, you have about 4 different waivers that are out there. There's the aging and disability waiver, comp and now waivers, which are more for mental health and developmental disability and cognitive disability populations. In the aging and disability waiver, it's really broken up into 2 different programs. So you have CCSP and you have SOURCE. And CCSP stands for Community Services Program, and SOURCE stands for a whole bunch of words that I can't actually remember at the top of my head. But the difference between they're very similar programs. We operate out of the same basic set of regulations. The big difference between SOURCE and CCSP is SOURCE currently, you have to meet, everybody in SOURCE has to be receiving SSI, so supplemental social Security income. And then also you have to use, it's more of a managed care program, so you have to use the source, a source provider's physician, and then it's much more of a managed care type of program. But overall, very similar types of clients in both programs.
Tom?
Yeah, just one thing. I think sometimes we make assumptions that everybody knows what we're talking about when we throw these initials around. When we're talking about waiver programs, we're talking about folks who otherwise would be qualified for long-term care, nursing home care, and what you're doing is waiving that care and providing them those in the services in the community. So it's much more cost-effective, as Representative Clark mentioned earlier about adult day centers.
Thank you, Mr. Chairman. Thank you all.
All right, number 11.
Yeah, I might just, first, before I was going to mention something that you spoke to, I might just, in light of Rick's questions, emphasize a couple things. Service options using community resources in the environment. That's the SOURCE program is a Medicaid waiver. They're serving about probably 15 plus or minus thousand people in Georgia, just so everybody understands. You're speaking to the number of adult day health facilities. Correct. And so I need to emphasize something. Not every adult day center is an adult day health center. So adult day health expressly is Medicaid related, but not every adult day program is Medicaid oriented. So everybody, that's real important that y'all emphasize that. So SOURCE and CCSP are both Medicaid programs. CCSP serving about 13,000 or so people, and they are absolutely waivers of Medicaid, Medicare, and CMS standards to allow us to serve people in the community as opposed to having them institutionalized. So I just wanted to emphasize that because I think that's a very important point that needs to be made. Going back to what you said, I would emphasize something. I think, first of all, this is a great idea to study this, but I would emphasize something. You mentioned the decline in people being served in these adult day health centers, which are Medicaid oriented. Right. And it should be emphasized that every provider providing Medicaid waivers has seen the same decline. So it is not about adult day centers. It's across the board, and it is, and I can tell you what it is, but it does need to be studied. It is a result of levels of care determinations. So the state has tightened up on who qualifies. They have to meet a level of care that is absolutely makes them eligible for nursing home placement, and that is why you've seen numbers decline. It should be studied, and it needs to be more than just superficial, but I can tell you, having lived in this world for a long time, that's largely where it's coming from, because every provider of service in HCBS has seen the same decline with SOURCE and CCSP. And so I just wanted to emphasize that. Your point about transportation is a huge one, and everybody in the system, especially docs, really suffer with our really inadequate transportation system for Medicaid individuals. Mm-hmm. But I just wanted to emphasize those points because I think they're real important. Thank you.
All right.
Yeah, what's also interesting is anytime I see a presentation about the overall numbers who are being served in CCSP and SOURCE and these waiver programs, it's a pretty steady number of folks. But if all the providers are seeing a drop-off, something's not quite making a whole lot of sense. If all the providers are seeing drop-offs in the number of people that they're serving, yet the total numbers staying the same, something's happening. And if the top line's changing, something's happening that needs to be studied so we can understand more fully, what's going on with adult day health in particular.
Okay. Number 7.
Do you think it's dropping off because the criteria have been tightened? Is that, if I understand that correctly?
I think that
if you can speculate.
if I were to guess at this time, I would say there are. This would be a guess, and I'm not sure that I would be in complete agreement with how you would look at it. What I think is happening for adult day health is that with transportation, that has diverted case managers' willingness to actually use the Adult Day Health Network, and so they are diverting. They're not really trying to sell the program or bring that option to their clients in terms of what in terms of what's happening on that on that ground level. So part of it's very much transportation level. There is clearly a part of this is the state has changed their some of their criteria, especially in the north, the source programs, in terms of who they're letting in. They're tightening some of those qualifications. But I do think that some of this is also a diversion to some other programs. If we were to kind of look at the, if I overall it's like about 35,000 between those clients served between the two, CCSP and Source, and that number is presumably stayed about constant. So I think you would find a little bit of diversion to some of these other services as well.
Any other questions? All right, thank you.
Thank you very much.
Is there anyone else in the audience that wants to speak to this that didn't sign up? Come on up. Come on up to the microphone, Kat.
Just wanted to say, Kathy Floyd with the Georgia Council on Aging. We are supportive of this study committee, and we appreciate Representative Valerie Clark introducing this. Thank you.
Is there anyone else in the audience that would like to speak to this measure? Ms. Clark, you want to? I've got a couple of questions that. Well, we'll go to number 12 first, and then you can.
All right, I was going to let a couple questions. We currently have a oversight committee, joint House and Senate, to review everything in DCH. Supposed to have us a report in January of each year. Why would that committee not pick up on this same topic, since most all this is coming out of DCH as well?
I would imagine, Representative Kirby, that this very well could be, but you can see that the problems are so in tune to this one issue that perhaps we could use a study committee on this one issue. And in particular, we're looking at closings, we're looking at reimbursement policies all over the map, we're looking at for-profit, non-profit, how many are there, which are they? We're looking at the result of levels of care versus transportation, and that is the only reason that I would hope that you would consider looking at this one issue, and it would be five meetings.
Okay. Okay. I've got a couple of questions, and maybe Mr. Morgan or Mr. Bauer might be able to help you answer some of the questions there. What if a person's not on Medicaid? What is the average cost?
That's going to be kind of all over the board, but the Genworth does a study each year where they're kind of looking at different costs of different aging services. And in general, I would say that your average cost is going to be about $65 a day, kind of nationally, for the adult day services, versus say an in-home care is going to be somewhere in the $18 to $20 dollars an hour kind of reimbursement rate if it's on a private pay basis. The $65 a day is going to be more of a private, is going to be for Georgia. That would be more of a private pay reimbursement.
Okay. Another question. I know that most of the people that end up going for this service are elderly. What's the percentage of those that are, say, 40 and younger?
Statewide, I don't know that I would be able to hazard a guess on that. In my centers, I would say that it actually depends on the area that you're in. So our center in Johns Creek is probably 10% or under 40. Our center in Cobb County is going to be closer to probably 30%. And so it also, some of the centers, especially like there's a center in Augusta where that center is also serving clients in the day habilitation programs for the comp and now waivers. And so they have a larger group of individuals who are in those programs. And so I would presume my assumption would be that population would be a little bit younger. But obviously once somebody's in the comp and now program, they're probably going to be in that for a really long time.
Okay. Number 11.
Yeah, Mr. Chairman, I was just going to speak to your question and
Okay.
emphasize that there are a great deal of day programs for younger individuals with developmental disabilities in Georgia.
Okay.
We have quite a few in my county as well.
All right. Thank you. Any other questions for Mr. Morgan? Number 12?
Not for Mr. Morgan, no.
Okay. You got a question from Ms. Clark.
Yeah, Representative Clark, under Section 6, under report, would you be receptive to amendment that would have the minutes and any report be made available to the Oversight Committee, the Joint House Senate Oversight Committee,
Absolutely,
and
sir.
have
I
it
think
included?
that is an excellent idea.
All right.
It's a great addition.
All right. I also have, in addition to the bill, I'd like to run by you on lines 53,
Sir?
where it says of the committee for more than 5 days.
Yes, sir?
I would like to strike the rest of that sentence and have it just be 5 days.
It is stricken.
Well, we'll have to do that in the form of an amendment,
sir,
but
we will.
I wanted to see if that was something you would be amenable with.
Certainly.
And Representative Kirby, where was that section that you were looking at?
Section 6, starting on line 56 through line 70. Maybe council can help with some good wording on how to, just the report and minutes will be made available and shared with the Joint DCH Oversight Committee.
All right, so why don't you write that out as the way you want that to be, and we'll, and where you think it ought to be. And then if that's not where it needs to be, we can get lead counsel to put it in the right spot.
And I am certainly agreeable to both.
Okay. At this time, we've finished the questioning. We are to the point to where the chair will entertain a motion. No, motion to for the bill itself. Then we'll go to the amendments. So move. I have a move. Do I have a second? All right, I have a move and a second that we adopt House Resolution 618. Now we're looking at amendments. We'll go since Representative Kirby's working on his. I'm going to go to mine, that is on page 2 on line 53, where after the word days, that we strike unless additional days are authorized. Can I have a move on that? Do I have a second? All right. All those in favor, if you would say aye. Any opposed, like sign? Okay, so that amendment is adopted. All right, the second amendment is on page 3. Representative Kirby. Sorry.
All right, thank you, Mr. Chairman. On line 67, adding the words, any report shall be filed with the chair or co-chair of the Joint House Senate DCH Oversight Committee.
Okay, so you'd start after the period after representatives with a new
Yes.
sentence.
Yes, sir.
All right, and would you read that one more time?
Any report shall be filed with the chair/co-chairs of the Joint House Senate DCH Oversight Committee.
All right. Has everybody heard that amendment?
And that committee was formed Senate Bill 62 in 2013.
Okay. We have a move. Do I have a second? Have a move and a second. Any comments on the amendment? All right. So we have a move and a second. All those in favor would say aye. Aye. All those opposed, like sign. The amendment carries. So that will be added to line 67, and everything will be moved down accordingly. Now we're ready to look at the bill as amended. We have a move and a second. Are there any other comments about the legislation? If not, all those in favor, if you would say aye. Aye. Any opposed, like sign. The ayes have it. The legislation carries and will be reported to. You can go by rules and ask for it. While I have everybody here, I know that we sent out an announcement several weeks ago and again last week about a dinner tomorrow night that was being furnished by a lot of our friends. I hope that y'all are planning on being there. It's at Capital City Club, and we have quite a few friends and there are going to be several committees there, so I hope everyone's made plans to attend. With that, all business being concluded, we stand adjourned. Thank you.